Cases of skin cancer are on the rise. By 2040, over 22,000 people in the UK are predicted to be diagnosed with melanoma, the deadliest form of skin cancer. With funding from the British Skin Foundation, a team at Newcastle University has developed a pioneering test which reliably predicts which people's early-stage melanomas are at low risk of recurring, offering patients reassurance and the possibility of more personalised management.
In a lab in Newcastle, a team of scientists and clinicians has developed a groundbreaking test that could revolutionise the way thousands of melanoma skin cancer patients are managed. Funded by the British Skin Foundation, the pioneering AMBLOR test reliably predicts if a person's melanoma is at low risk of spreading, which could change follow-up management and treatment.
So here we have an example of an early stage melanoma, which has been subjected to our AMBLOR test.
Lead scientist Professor Penny Lovett explained exactly how the AMBLOR test, which is being produced by the university spin-out company Amlo Biosciences, works.
So we're looking for the presence of AMBRA and loricrin in the epidermis, or the skin that overlies the top of the tumour. And if both these proteins are present, then the tumour is at genuine low risk of disease reoccurrence or progression. As an academic with a long-term interest in melanoma, I think I've really been inspired by some of the major challenges that are still unmet in terms of clinical needs for patients who are diagnosed with melanoma. And perhaps one of the greatest ones is for those who are diagnosed with early stage disease. Most people do very, very well, but there are a small percentage, up to 15%, whose disease will reoccur. With the support of the British Skin Foundation, one of the greatest things that I've been able to do is to develop a novel test that can accurately identify those patients with early stage of melanoma at low risk of their disease recurring. Of course, this has a big impact in terms of relieving patient anxiety, but also aids clinicians in being able to look at a more personalised way of managing patients.
By identifying patients at low risk of progression at an early stage, the AMBLOR test has the potential to reduce the physiological and psychological burden on the individual. But if clinical changes to management are made, also the potential cost of follow-ups and medical interventions to the NHS. For the charity which co-funded the early research that led to the test, the groundbreaking results from the female-led team of scientists have been inspiring.
We're a really small team at the British Skin Foundation, and we all got into charity work because we want to make a difference in the world. So whenever there's a breakthrough, it really helps everyone in the office. Like, it inspires us to carry on with the work that we're doing, to help raise more money and to, put everything we can into our work.
With the support of the British Skin Foundation, what we've been able to do is show that the survival of those patients who are identified as genuinely low risk by AMBLOR is much improved.
The Newcastle University team is now full steam ahead, working on further research funded by the British Skin Foundation.
We're already funding the sort of follow-on from this research, so it's very much a case of watch this space and see how it develops in the next few years. We're going to continue to fund some follow-on work from Penny's initial research, and hopefully that means that in the future there'll be better patient outcomes for thousands, if not millions of people.
Our new research that's sponsored by the British Skin Foundation is focused on trying to identify those patients who are actually at risk of their disease spreading. It's enormously exciting. It's been a great journey. I have to say that, the British Skin Foundation have been fundamental to my career development, the development of many colleagues who have trained with me, and into being able to identify a test that can be used in the real world globally and will help patients in the future management of their disease as we strive hopefully one day to finding a cure.
Spurred on by this latest success, the British Skin Foundation will continue to create opportunities for researchers to improve patient outcomes, potentially saving lives around the world in the future.